Across England, the standard of support in nursing homes varies greatly, with residents often excluded from vital health services they need. Through collaborative working, the partners of the Sutton Homes of Care Vanguard programme have identified areas in care homes that need urgent attention. Julie MacDonald reports now from Crossways nursing home in Surrey, where nurses are training staff to improve the health of their residents.
Care homes have typically been isolated organisations with little interaction from health and social care. That can often mean that staff have little training and support, but also that residents of care homes are missing out on vital services. In Sutton, just outside central London, the local CCG is taking action, creating the Sutton Homes of Care Vanguard, which is revolutionising care for elderly people in the borough, where primary care and community services work together, using a do with, not to approach.
And one of the key things that's happened for us in Sutton is that there's been a reduction of people who live in care homes being admitted to hospital as an emergency. Now that's a good thing for the people, but it's also a cost saving for the NHS. One of the aims that we've had with this programme is to acknowledge that nursing homes often work very independently, and part of the programme says you're doing a really good job, but it could be better, and we need to support you to do this better.
Liaison nurse Pat is visiting Crossways Care Home in Sutton to deliver training to staff members, just one of the programme partnerships in the community.
It's a role that's really exciting because actually we link in with the care homes in the borough of Sutton. If, for example, a resident has a catheter in, historically what would happen is if they needed it replacing, would go to A&E to have it replaced, because sometimes the nurses may not have that skill set. Actually, we understood that they needed the education, so we could provide them with the training and the clinical support.
Debbie Lyndon Taylor is the Divisional Clinical Director of Nursing for the Royal Marsden Community Service, and she told me just how vital this relationship building is.
The first thing is very much the strong partnership that we have here in Sutton. We provide the community health services, but we work very closely with Sutton Social Services, the CCG, Clinical Commissioning Group, and all the other partners. We provide training and education, and we have a very much whole systems collaborative approach to supporting the residents.
In the past, a lack of trust between community health services and care homes sometimes prevented continuity of care. But now the care home support team with linked nurse specialists, palliative care nurses and therapists are working in partnership with staff in the care homes.
And it's only through the linked nurses and the home staff that they've built that relationship where they'll communicate. They do wellbeing rounds together, so it allows a lot of early detection, which allows a greater preventative measure rather than being a reactive service.
One Crossways resident benefiting from this collaborative approach is Donna Rolls. Originally admitted for end-of-life care, she's now walking again and recently got married at the home.
I came here in June from the hospital, and then they didn't expect me to live till Christmas. The health advisor was very good. She said, well, let's try and go to the commode gently and so on. So I gradually had strength to sit in the chair, and now the last few weeks I'm able to do things for myself.
Mary Hopper is the Director for Quality and Transformation at Sutton CCG, and she's convinced the power to make real change lies in the hands of senior directors.
For people in my position, it's really important that you give permission and you respect the people out in the ground, because actually having a nurse, an ambulance driver, somebody working in the care homes actually coming together and sitting down and saying, guys, we've got a problem, what can we do to sort it, is actually really good use of people's time, and it creates trust, it creates an understanding of one another's roles, and it enables solutions to be found.
Donna will live out her days in dignity and kindness at Crossways, getting the sort of collaborative care that every elderly person deserves. So could Sutton's powerful model for change become a standard bearer for elderly care across the nation?